Hey, good morning, everybody. I'm here with Sue. How you doing, Sue?
I'm great. How are you?
Hello, everybody. So, I'm Dr. Sue, and here at ArtLipo, one of the things that I specialize in, that very few doctors in this country specialize in, is treating lipedema, which is a fat disease. Fat accumulates in certain areas on the lower legs and on the arms. And if you are not familiar with this disease, or if you read a little bit about it, it causes tenderness, heaviness, pain, discomfort for women who suffer from it. And it's can be a debilitating thing if it gets really severe, but it's also debilitating, I think, emotionally, because women who suffer from this oftentimes get fat accumulation in these areas early on in life, and it's an embarrassing thing that doesn't go away with typical diet and exercise, right?
Correct. Mm-hmm.
So we're here with Sue, and we're doing this video today because Sue is someone who has been diagnosed with lipedema. She did have a lot of fat down on her lower legs.
Correct.
And she has some lipedema on her arms. And I'm going to let her talk in a second, but just to give you some background, Sue is a returning patient from about a year ago, right?
Correct, yes. Okay.
Where we actually took care of her leg from about mid-thigh all the way down to her ankle. So we call that the knee complex and cankles. So we got rid of a larger part of her problem last year, and I'll let you tell them a little bit.
Life-changing.
So you're going to tell us your story.
Yes, so I was always a very thin girl my whole life, but when I hit puberty, my body started to change, and I didn't know what was happening, but it was all in my lower body. My upper body was small, my lower body just started to get huge for my frame, and I just totally didn't understand it, and I became very insecure, like you said, because I was trying to diet it off and exercise, and nothing was happening, and I had all these fat deposits all over my legs, a lot of cellulite. So it was a battle I've had for years until about 12 years ago, when I finally got diagnosed that I have this disease, lipedema.
Right.
And I researched it and realized there's not much you could do. The only way to lose this fat, they call it disease fat, is by removing it, by liposuction. Yeah. So I researched for years, and I finally came across Dr. Sue and saw his before and after results with other patients, and I was thrilled looking at that. So I made the trip down from New York. And last year, we did the Cankle area and my knees, and I was thrilled with the results. And now I'm back for the inner outer thigh, and we're going to also do the arms.
Which is also an area that affects about 30% of patients with lipedema. So and it follows the pattern. I'm going to back you up a little bit, because I know a little bit more that I think is pretty significant. You actually had treatment of your entire legs.
Yes, I did.
Early on.
Yes. So about 30 years ago, I did go to
you were
plastic 20s? Surgeon. Yeah, in my 20s, I went to a plastic surgeon, and he did a liposuction treatment, but the results were not anywhere near.
Leg, right? All the way down.
The entire leg. And it really didn't make a change in my contour of the leg. So I wasn't thrilled, but I had, and then later in life, I figured out what I really had, which was lipedema. Right. And I researched doctors that do treat lipedema, and you came up.
And so over the time period, it sounds like things also progressed.
Yes.
So the initial liposuction, which was done by this doctor, was done in two separate treatments.
Correct. Okay. Yes.
But made some difference, not complete, right?
Right, and he had no idea it was lipedema.
Right, he was just treating the ankles and the leg areas.
Right.
So anyways, what we did last year was actually a secondary treatment, what I call a redo treatment. Oftentimes that can be a lot more difficult. In Sue's case, I can't say that it was a lot more difficult, but cleaning up some areas that were irregular, and when we show you the before and after photos, you'll see over her knee the areas were wavy, and just the contours were not good looking because they had been messed up a bit. So I think we got a pretty good improvement in that, but we didn't get a 100% improvement. But anyways, we're going to finish up her legs now.
Yes.
And the inner and outer thigh. You already look great, in the bikini.
Thank you.
But what we're going to do is we're going to get rid of some of the upper areas because lipedema can affect the upper thighs too. Did you have any symptoms in your upper thigh area?
No, I didn't. Most of the pain was throughout the lower area.
Okay.
Yeah, like a heaviness and discomfort.
Yeah, and this is important for women out there to understand. Lipedema is a very new, in the realm of medicine, it's a much newer medical disease diagnosis. I didn't even know about it until about 5 years ago, what it was. A lot of doctors, even today, don't know. If you go to the doctor, your primary care doctor, and say,
heard of it.
hey,
Yes.
I think I may have lipedema, they may say, I'm not sure what that is.
Yeah.
Or are you talking about lymphedema? Because
Right.
lymphedema is swelling due to fluid. It's not a fat disorder. And it sounds very similar.
Right.
So anyways, the thing to know is that if you're having achy fat, tender areas in your legs that just hurt when you touch them, that's not normal. And
Right.
a lot of women don't know that. They think, oh, well, that's just me. It's
Right.
it's not a medical disorder, and yet it is. We're finding out how common this is. They say almost 1 in 11.
Oh yes, and it's hereditary. It's my grandmother had this, my mother, but didn't know it. I mean, my mother and my grandmother never treated theirs. They just, their legs got bigger and bigger as they got older.
So it's not just fat.
Right.
And it's not just tenderness for no reason. It is a disease process. So I just want to toot my horn a little bit here, and just kind of and let you guys know a little bit. Liposuction in general is not the same from doctor to doctor. I mean, you really, need to find the right doctor to do your liposuction because most doctors are taught to do it very conservatively, which means removing about 50% of the fat only. But we do a very advanced form of liposuction here, based on my art experience and the advanced techniques we've done to create a much more complete liposuction. Usually about 80 to 90% of the fat is removed. But we also do it in an artistic way, which is sculpting. And when we show you Sue's legs here, you're going to see it was sculpted, and you can see every muscle, and it's defined. So you have to pick your doctors carefully. And this is one of the reasons I asked Sue to do a video with me. We have lots of repeat liposuction, doing areas that other doctors have gone in, partially removed, and in some cases left lumpy and bumpy, because unless you have really, really highly developed skills, lumpy and bumpy is a pretty common phenomenon out there with liposuction. It has to be controlled and it has to be done artistically. So yes, there's some other doctors doing lipedema treatments of the legs. Here, I specialize in it. We do about a case a day right now, and just seem to get more and more. So we do about, right now, a few hundred patients a year, and I've done about 500 or more patients. Patients like that come to me all the time tell me how difficult it is to find someone. Could you even find, you live in New York City.
New York. I researched for years, and I looked at before and afters with other doctors that do this. And
how many could you even find?
Oh, very few.
Like how many even on one hand?
Oh yeah,
in this entire country, maybe
5.
this many.
And their results are not what I saw when I came onto Artistic Lipo website and I saw the before and afters. I said it can't be real. That can't be possible. and I was.
And that makes
so
me feel
excited.
great because I hear that a lot.
Yes.
Even from doctors, they say that can't be real.
I know.
Those pictures are photoshopped. So
Yes, and
they're not. We do videos right when we're finished.
So what I had done, Dr. Sue asked me to take pictures of my legs, and I sent them to him, and he drew on the picture. He said, "This is what your leg's going to look like," and I'm like, "If you can make that happen, I will be ecstatic." And I walked away from here, and my legs looked exactly like you said they would. And they're contoured. I have an ankle. I have a nice calf. And not a Cankle anymore. And I enjoyed last summer showing my legs. I wasn't hiding behind long skirts and flowy pants anymore. So it really changed my life.
I'm glad it's made that kind of difference. And one reason that I love to treat this area is because it can make such a difference
Really?
for patients. I would say, the majority of my patients, it completely changes their life emotionally.
Oh.
And, you know, so from a aspect that they can go enjoy life and do the things and wear the clothes and be confident in their bodies. And I've been doing liposuction for 15 years, and when I did tummies and waist and other areas, it was good, but it wasn't life-changing like it is for women with Cankles or with lipedema.
Oh, yes. Everyone in my family and all of my closest friends could not believe the transformation. And I can't believe it. When I look in the mirror, I just can't believe those are my legs because I hid them for so many years.
So one of the things that that Sue brought up that is different about us is that we show, like when I look at someone's photos when they send them to me, and we're mainly doing this long distance because I treat people from all over the country and all over the world, I can actually visualize what your leg is going to look like underneath. It's just, I've been trained, it's in my, with my fine arts degree and doing figure drawing for years. I know what's there. So I do something that's a little bit different. I don't tell you, okay, yeah, it's going to be better. I will actually draw on your photograph and show you what your new leg will look like, and we'll hit it very close.
Very close.
Very close. So,
yes.
You know, you'll have a good idea what it will be before you even get here, even without me touching your legs.
Right.
But yeah, I'm glad you brought that up because that's something I do that I don't think any other doctor
I've never seen that
does
before.
that. Yeah. Okay. So here are her thin, defined lower legs, calves, ankles. Can you go up on your, turn sideways a little bit? Mm-hmm. Yeah, just go around and just in the tippy toe fashion right there. Okay, and then you can come down. Good. Okay, so this is what her legs look like now. We still have some areas that I've marked right there, her inner and outer thigh, that we're going to go and get, and then, but you see how skinny and and in shape Sue's body is. And then hold your arms up like this, and I'm sorry, come on back right here. Mm-hmm. So this is, you can see she's got some nice biceps, but this is a hang of fat right here. Mm-hmm. And if you bring your arm down to its side right there, this fat right here, which has a pattern kind of hangy toward the elbow, is something that I've seen a lot with women who have lipedema. I mean, you can have fat, most women have the fat accumulation closer to the shoulder and it tapers and thins out, but the women with lipedema seem to have it more toward the elbow.
Right.
And you see how thin she is and in shape. So we're going to remove that fat. We'll come back after we've done some of the areas, and we'll let you see, and then you'll get to see the before and after photos too. Okay, bye.
Thanks.